Hi, Paul Feuerstein here, Technology Editor of Dentistry Today. And I have the great pleasure to be sitting here with Sally Revell from Philips Sonicare. And Sonicare needs no introduction. It's one of the premier oral hygiene devices that's on the marketplace. But Sally needs an introduction. So Sally, tell me what you do for Philips, and also why are we here?
Thanks, Paul. So for Philips, I work in product development. So essentially, I'm the marketing director for Connected Propositions. And why we're here today is because we're launching the first adult connected proposition, FlexCare Platinum Connected.
Now, when you say connected, what are we connecting this toothbrush to?
Well, the toothbrush is connecting to a brand new app that we've created that works on iOS and Android. And basically, we send data from the toothbrush into the app to help consumers and patients increase their brushing compliance.
So it just says I brush for 2 minutes?
No, it does way more than that.
Okay.
Well, first and foremost, what you've got is the superior technology of Philips Sonicare. This is the best performing toothbrush in the Philips Sonicare portfolio. So, a great toothbrush. And what we've done is built on that with smart sensors in the handle.
Sensors like showing GPS around the mouth, for example?
Basically, just like that.
Wow.
So that would be the easiest way to describe it. So we have a location sensor so you know exactly where in the mouth you've got the coverage and if you're leaving any plaque behind.
What if I'm brushing the wrong way or pressing too hard or things like that?
Yeah, good question. So we also have a scrubbing sensor. So if you're moving too vigorously and not gliding per the technique that we recommend with Sonicare, it will real-time give you that feedback that you're scrubbing so you can improve your technique. There's still the pressure sensor that everybody knows and loves in the handle that gives the visual and the haptic feedback,
Sure.
but also real-time feedback pressure sensor from the handle into the app so you know when you're pressing too hard.
Now, does the sort of guide me around the mouth in different quadrants or sextants, or how does that operate?
Yeah, so actually we've broken it down into 6 segments and we use the brush pacer. So we used to have the quad pacer, we've now changed it to brush pacer because it's 6 segments.
So I do about, what, 20 seconds in each area? Would that be right?
20 seconds
Good
in each
math.
area, exactly, yeah. For the 2 minutes of clean, of course. But what's really important is in each of those 6 segments, we've even broken that down further into 2 sub-segments. So we know if you're on the lingual or the buccal surface.
And it records all this?
It records all of that.
So this information gives back information to the patient, certainly for some feedback. I assume it's live,
Yep.
but it also archives it.
Yep. So you can get aggregated data over time. So the whole point is, if you as the dentist have given certain feedback to your patient about brushing technique, in between dental visits, you can see exactly if that technique has been followed and how they've been brushing.
So if I have a patient that's non-compliant in the upper left quadrant, I can say to the patient, you must work a little harder in this area. We can actually validate that they actually did that.
Yeah, and not only can you validate that with the aggregated data that's collected over time, but as the dental professional, you can also identify in the special mouth map that we've created in the app, focus areas, and those focus areas are included such as where you may have some gum recession coming, where you may have a cavity that's coming. So you want to identify those areas that patients need to remember. So they never leave the office without having that specific record of where they need to focus between their visits.
But it's almost like artificial intelligence telling you, you know, you should be spending more time on this area or this area, and you missed it, and it actually it'll chart out where I've done well and where I haven't done well?
Exactly. And even taking it to the next level, that then not only does it chart that out, but we've then created an algorithm and a personalized coaching experience that then takes all of that data and surfaces DP tips. So we've worked with our dental professional colleagues to create coaching tips and advice throughout the app. All of that gets customized based on the patient's actual brushing habits. So it's not
a little chart that says this is what you should be doing after you've brushed so many times.
Yeah, and
Wow.
say, if you have a certain goal to get fresher breath, or you do want to improve your gum health, all of that is totally personalized. There is no one size fits all. We're using the technology, using the big data that we have to create something just for the patient.
And the connectivity is to the iPhone or the iPad or an Android system. I assume there's an app, obviously.
Yeah. So this all happens on the app. We use Bluetooth connectivity right now, but anybody can create a Bluetooth toothbrush. We know there are many out there on the market. What's special about ours is the smart sensors in the handle are the same sensors basically that you have in a mobile phone. Like you said before, the GPS for your mouth.
Well, more important, I mean, there are a number of toothbrushes coming out in the marketplace with Bluetooth technology, but they don't have the Philips Sonicare brushing technology. And I think that's very, very important to understand, that you can have all this slick technology embedded into your toothbrushing, but the basic toothbrush has to be doing the correct thing in the first place. I think that's a big key point.
Yeah, quite agree. And that's why, in our research and what we've seen as we've presented this to more than 500 dental professionals throughout the research is that combination of having the great technology of Philips Sonicare, but then what we're bringing through the app experience and that ability to help patients, with address those trouble areas and be more compliant between their visits is just now mind-blowing in terms of the benefit that we're going to be able to deliver and the healthier mouths that DPs are going to see every day.
And I wondered why I was going to be talking about a toothbrush, not realizing all this embedded technology, which is unbelievable. Now, when the dentists or consumers want more information about this product, can they just go to one of the Philips websites?
They certainly can. So they can go to the Philips Oral Healthcare website, which is pohc.com.
That's terrific. Sally, this is just astonishing. It's been great talking with you. Thank you so much.
Thank you.
And I learned an awful lot today.
Thank you.